Very good afternoon to all of you. I will be highlighting on the cancer awareness, screening and early diagnosis. And I will focus on these major topics for you. As shown here in this slide, the cancer burden of India in comparison to the world is shown here. Breast cancer is the #1 cancer not only in the world but also in India. Breast, oral and cervical cancer are the three most common cancers occurring in India, accounting for 34% of all cancers in India. According to NCDIR ICMR 2020, cancer of mouth, lung, stomach, colorectal and esophagus, they are most common cancers in men, while cancer of breast and cervix is the most common cancer in women. The highest burden was found in Northeast region in India. There is a rise in trend of incidence of cancer breast, while cervical cancer is on the decline. But tobacco-related cancers are likely to account for 27% of India's cancer cases, giving rise to the increased burden of cancer in India. The age standardized incidence rate for India for breast cancer is 26 per 1 lakh women. For the cervix, it is 18 per 1 lakh women, while for the lip and oral cavity is 15 per 1 lakh men. Not only this, but the mortality from breast cancer is highest, followed by the cervical cancer. So hence these three cancers, that is breast, cervix and oral, are the common in India and are targeted by Government of India under the national program, as they can be screened, detected early, can be prevented, reaching to the advanced stage where treating is difficult for the health professionals. Now this slide shows the evolution of cancer control program in India. In the year 2010, the cancer control was merged in the NPCDCS program, that is a National Program in Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke. This was implemented in India in the phase-wise manner and currently covering more than 600 districts through the more than 5,000 NCD clinics at community health centers across India. 266 daycare centers for cancer care and 187 functional cardiac care units. Government of India has developed the customized module of training of all the staff. Guidelines, operational frameworks were prepared for covering the all aspects of program, including the community health workers, grassroots level workers such as the ASHA, ANM, MPW, CHO, medical officers, and the other health staff. The broad programmatic guidelines, they mainly focuses on the opportunistic screening within the existing public health system framework. Now, this is the community-based assessment checklist or CBAC form for the early detection of non-communicable diseases by the grassroots level workers during their fortnight visit, that is the ASHA workers in their community, which includes a set of the questions for the men and the women to find out what are the early signs and symptoms of these common cancers, so that, they can refer them with the referral slip. Now, these are the available tests for the screening of cancer, cervical cancer in India. The secondary prevention of cervical cancer with the help of the visual inspection with diluted acetic acid of the cervical os in the sufficient light by the trained healthcare primary healthcare worker at the health and wellness center or the primary health center or the community health center for the women between the age group of 30 to 65 years in India is recommended. This slide shows the recommended VIA strength, the test strength and the limitations. The strength is being the non-invasive and it is inexpensive, easy to learn and does not require any lab involvement. It is a real-time test and the results are available immediately. Even the non-physicians can be trained for this. The efficiency and the cost effectiveness of this test has been evaluated in 2 randomized control trials showing the significant mortality benefit. The WHO recommended VIA-based screen and treat strategy that or the single visit approach or SV approach with the cryotherapy is adopted by Government of India. Secondary prevention of breast cancer by the clinical breast examination. The steps are mentioned here by the trained primary health care worker in the primary health center or the community health center for the women between the age group of 30 to 65 years in India is a practical, cost-effective way of the screening. But still, there is a need to address the value of self-breast examination. The secondary prevention of oral cancers by the oral visual inspection of the at-risk population who are using the tobacco, alcohol, ericanet, or the mixed use of the by the trained primary healthcare workers at the wellness centers is recommended. A meta-analysis of this OVI studies conducted in developing countries indicated a satisfactory test performance, and a community-based cluster randomized control trial conducted in Trivandrum showed a significant 34% reduction in the mortality because of this test when it was implemented in the community. This particular table shows the format for the screening and follow-up of the common cancers, which mentions who should be beneficiary, what should be the frequency of the screening, and what is the next plan of action in case of the screen positive patients. This is the referral slip to be provided for further investigation in case of suspected symptoms by the trained ASHA workers or the healthcare workers. While this is the algorithm of screening and management of the breast cancer, this is the algorithm of screening and management of the cervical cancer. This is the algorithm of screening and management of oral cancer. Tobacco kills more than 1 million people per year in India. Tobacco is identified cause of cancer. Still, the consumption of tobacco is high in India. The activities which are conducted to prevent tobacco-related cancers in India, they include the 85% of the principal display area of tobacco packs should have the pictorial health warning, National Tobacco Quit Line, End Cessation Program, National Tobacco Testing Labs, Global Knowledge Hub on the smokeless tobacco, and the guidelines for tobacco-free educational institutions, and also the coordination with the Panchayati Raj institution. We have a COTPA Act, that is a Cigarette and Other Tobacco Product Prohibition of Advertisement, Regulation of Trade and Commerce Products, Supply and Distribution Act 2003 for tobacco control in India. The government has released a computer software for the field implementation of these guidelines and the delivery of the comprehensive package in those centers. Pilot study was conducted to evaluate the implementation of these guidelines, which found out the lack of motivated healthcare professionals, difficulty in motivating the community, and lack of the higher referral centers for the management of screen positive patients were the challenges. But according to the National Family Health Survey data, the screening rate for common cancer is less than 2% for all these three common cancers, indicating that there are barriers of availing the screening facility and or the challenges of implementing the screening modalities. The broad pragmatic guidelines by the Government of India mainly focuses on the opportunistic screening within the existing public health system framework. These pose a unique challenge such as the cost of administration, training of the manpower, access to screening facilities, their follow-up management, adequate linkages for the confirmatory diagnosis and subsequent treatment. So the health resources allocated toward the cancer control, they vary between different states. Per health wellness center, currently 50,000 is provided. Infrastructure and resources required to conduct the screening and further investigation, and the primary care facilities being poor. Also, there are challenges in improving the cancer screening, as the current practice is opportunistic screening. The limited screening behavior among the eligible women need to be researched and should be executed with the specific community education and the screening programs. This will reduce the patient delay to access the care and delay in the diagnosis and treatment. A recent narrative review by the researcher found out limited awareness about the risk factors and the screening practice. The possible solutions of adequate, adroit, motivated healthcare professionals, then the dedicated budget and strengthened healthcare system will help achieve the awareness and cancer screening. Considering the complexities involved in the National Cancer Grid, NCG, a consortium of more than 180 cancer institutions in India, provide the evidence-based strategies and approaches to help adopt the best practices in this field. In terms of the tobacco-related cancer prevention, it is highly essential to find a means of reduction in the tobacco consumption, strengthening the tobacco cessation services, and timely achievement in the COTPA Act. A suggested approach is to develop the tools that can enhance the skills of the healthcare providers, appropriate referrals, robust real-time data monitoring, and its evaluation. To raise the awareness, we need to identify the target groups, for example, which community, who are the stakeholders, and how we can keep them engaged. What should be the mode of dissemination of an awareness? Print media, direct media, or an electronic media? And then how do I manage the event? Engaging the stakeholders help the successful implementation of the program. Develop the message that effectively inform men and women who are targeted for this. And decide the geographic location where you want to implement this particular screening or awareness session. Decide on resources in terms of manpower, material, money, machine, mode, infrastructure, transport of the speakers. So prepare a checklist for conducting the cancer awareness. Publish the event once you conduct the event for motivating people who are involved and who could not avail the facility. Observe the events on various health days. Our department is constantly involved in such activities such as cancer awareness at educational institutions, at government institutions, conducting virtual symposium on the day of World Cancer Day during COVID times, virtual symposiums on the occasion of World Cancer Day with the Neuroscience Center. Community outreach program along with the training programs are conducted regularly. Administering the workshops on the preventive oncology and cancer screening. Not only this across India, but overseas also. So capacity building and training program with hands-on training for medical officers of various districts of Maharashtra. Not only this, but on-site hands-on training for the private medical institutions. You can see here the pictures where the hands-on training was provided on site. Collaborated with Public Health Department, Maharashtra State Government and the private partners, we are spearheading the hub and spoke model at Khopoli, which covers the distant areas. And the extension of our services that is currently in budding state of art satellite center at Gadchiroli is an example of reaching out to the difficult area. Collaborating with the government or the municipal medical colleges in terms of training and research, which helps dissemination in the modern with the modern ideas much quicker on the larger scale. Alliance with the other state can reach and propagate this knowledge to more number of healthcare professionals. To achieve the sustainable development goal by the year 2030, the way forward is systematic organized screening of the target population and timely treatment of the detected lesions. Thank you very much. So I'll stop sharing my presentation. Yeah.
थैंक यू सो मच डॉक्टर सुबिता, और जितना सारा आपने काम किया है उसके लिए बहुत बहुत धन्यवाद और बहुत ग्रेटिट्यूड ऑन बिहाफ ऑफ एंटायर कैंसर कम्युनिटी, बिकॉज ये तो मैं कह सकता हूँ कि एक शुरुआत है और भी बहुत सारा काम किया जाना बाकी है। और आपकी बातों से मुझे एक जो चीज़ समझ में आई कि आज जो अपॉर्चुनिस्टिक या एक्सीडेंटल डायग्नोसिस हो रहा है उसको शायद और स्ट्रक्चर्ड मैनर में हमको करना चाहिए। एंड अगर कैंसर एक बहुत बड़ा ताला है तो शायद अवेयरनेस जो है उसकी चाबी है, और इस पे हमें और सारा काम करना चाहिए। Thank you so much for joining us and sharing your views on that.
Thank you.